Hi everyone, Dr. Kalaiko here, and I want to give an update on COVID vaccines and the impact on fertility, pregnancy, and lactation. So the CDC recommends COVID vaccines to everybody who's age 12 and up, including anybody who's pregnant, lactating, or who may become pregnant in the future. And these recommendations are backed up by the American College of Obstetricians and Gynecologists, or ACOG, as well as the Society for Maternal and Fetal Medicine, or SMFM. They also recommend the vaccines for these groups because vaccination is the best way to reduce the risk of COVID-related complications for the patient and their baby. So I know you have questions. So let's start with the impact on fertility, because this is a concern for many young people who are planning to become pregnant. So there have been several anecdotal reports of menstrual changes after vaccination with the COVID vaccines. And these are real. People are experiencing real things in terms of changes to their periods. Now, the data is actually showing, when they look at the rate of menstrual changes in people who have received the vaccines versus in the general population, that the rate of menstrual changes are actually low in those who have received the vaccine as compared to the general population. And also, there is zero evidence that the vaccines affect fertility or would affect fertility or the ability to have children. So in fact, thousands of people have gotten pregnant after receiving the vaccine, including several who have been undergoing in vitro fertilization. So let's talk about pregnancy then. So first of all, the risk of severe COVID illness is higher in pregnant individuals compared with those who are not pregnant. So we're talking about hospitalization, ICU admission, ventilation, and requirement of oxygen. So in one study, it was showing that 5% of all pregnant women who got infected with COVID developed severe or critical illness. And then a separate study of pregnant women indicated that this risk looked to be around 13%. So also, if you do get severe COVID during pregnancy, the risk of preterm birth, preeclampsia, and stillbirth are higher. Now, so far as those who have been registered in the vSafe registry, so this is the CDC's registry that keeps track of safety and side effects after vaccination, nearly 150,000 pregnant individuals have already received the vaccines in the US. This is likely an underestimate, actually, because not everybody registers themselves into this vSafe registry. So vaccines do not increase the risk of either miscarriage or stillbirth. The rates of miscarriage and stillbirth in those who have received the vaccines are low compared with the general rates in the general population. There have been some social media posts floating around that were claiming that there is an 80% risk of or rate of miscarriage from vaccination, and those are false. So that was a misinterpretation of the data tables. So I'll have links to all the references below in the comments, in the comments section. So if you're pregnant and you get the COVID vaccines, the side effects are very similar compared with those who are not pregnant. So the sore arm, the fatigue, maybe low-grade fever. So, the most common medication that people generally take to relieve those symptoms are acetaminophen or paracetamol. So now let's talk about lactation. So many studies have been showing that those who have received the COVID vaccines and that are breastfeeding or chest feeding are able to pass antibodies on to the baby. So this may actually offer some protection to the baby, and studies on that topic are ongoing. Also, many have questions on milk supply. So what the latest studies are now showing is that after the first dose, 5% of the patients reported a decreased milk supply for less than 24 hours. And after the second dose, about 7% were reporting a decreased milk supply. Again, this lasted less than 24 hours. So there might be some impact on milk production, but it appears that the effect is pretty short term. So overall, I hope that information was helpful. Feel free to use this information when you speak to your own medical provider and see what they recommend. And I hope it helps you make an informed decision for yourself. I want to send a special shout out to allsourcepregnancy.com for compiling so much information and for providing all of these different references, which I will link below.